Many child care centers across the country remain closed because of COVID-19. Others are open, but many parents are wary, instead looking for options with fewer kids and possibly lower risk. It's why experts tell us in-home child care operations could begin to thrive, with new locations popping up in places like Texas. All this week, with a team of journalists across the country, we're exploring help for students and their families who've been set back most by the pandemic. For instance, in Texas, before COVID-19, there were 4,700 licensed and registered home-based daycares. That number declined by August due to some closures, but experts predict it'll shoot back up as needs increase. KXAN's Arzo Dost takes a look at this early education trend in Austin, a solution with a silver lining for some child care providers.
Tucked away in this southwest Austin neighborhood, Norma's Daycare is open and now includes COVID-19 screening.
They're not allowed to come into our home until we take their temperatures.
Across town in the southeast corner of the city, Loretta Johnson is also taking temperatures and offering hand sanitizer.
We began to do our motor skills, which would come with Play-Doh, crayons, drawing pictures.
Loretta cares for 6 kids in her home, all under 5. Norma's group isn't any bigger. On this morning, learning moves to the backyard while it's still cool.
Anything that's eye-hand coordination is extremely important. So that is going to be the basis for them to continue on when they go into school on their own.
Norma says she's hearing from parents looking for care with fewer kids and a program which offers dual language.
A lot will come in asking automatically, "Are you bilingual?" "Yes, I am." "Will you talk to them in Spanish?" And I said, "Yes, I do talk to them in Spanish."
The first 5 years sets the tone for the learning for the rest of their lives.
Go Austin Vamos Austin, or GAVA, works with home-based childcare providers in marginalized and low-income communities.
Without this kind of care, we would see a disruption in both children's well-being, the consistency of care that children need to be able to thrive.
How do you measure the success of a home-based program when it comes to education?
They arrive to kindergarten ready to learn. They have already established the early skills that they need to be successful in school.
Can they get along with their peers? Can they self-regulate? Do they have the vocabulary and verbal expression skills of a 5-year-old?
Kathy McHorse is with Success by 6 at the United Way for Greater Austin. The organization focuses on early childhood education and is now working with nonprofits like GAVA to build support for home-based operations. The goal is to understand and track children's developmental skills to improve school readiness when they go to kindergarten. Details on how that will be done are still in the works, but McHorse says a big part of it is making sure providers have access to training and resources, which can be tough to navigate. What are the challenges?
For people whose language isn't, their first language isn't English, just understanding the requirements, filling out the forms and the background checks. A lot of the providers don't have technology.
Licensing requirements in Texas say home-based providers can have up to 12 children in their care that are 13 and younger. The more kids providers care for, the more stringent the requirements by the state, including inspections. McHorse says before the pandemic, there was a decline in home-based childcare statewide and nationally because of the lack of support and resources. She says COVID-19 is changing that.
The trend right now we're seeing is just families are not comfortable going back into larger group settings.
1, 2, 3, 4.
Norma's group comes from families working in healthcare. The 67-year-old herself is considered high risk for COVID-19.
I certainly don't want to bring it home to my family.
She's had to close twice because of exposure concerns. Across the state from March to August, 91 positive COVID-19 cases, including children and staff, have been reported at home-based operations. That's about 2.5% of total cases reported at all child care centers in Texas. Despite risks, Norma and Loretta say they must stay open. Between the two of them, they've taught and cared for hundreds of kids in their communities.
And when I can see my 2-year-old saying the colors and knowing what their letters are when you point to them, that is my success. I know I have done my job.
In Austin, Arzo Dost.
During the pandemic, funding has also been a hurdle for home-based daycares. City of Austin, along with several groups, created an emergency grant fund for these providers to cover their extra cleaning expenses. Groups like GAVA are also helping with masks, thermometers, and cleaning products. All week, we're bringing you stories like this. As part of this project here on KXAN, we found one school district adjusting the way it gets food to students in need. You can see how it's working tomorrow morning on KXAN News Today. Online now, Pandemic Pass or Fail, Solutions for Education Equity, the Digital Investigative Project. Check out our latest work, interactive data features, and a behind-the-scenes video about why we're tackling this topic. Explore stories from our team of journalists across the nation, by location or by topic, plus resources about the solutions we're discovering and ways you can join the conversation. It's all online now. Just search for Pandemic Pass or Fail on our homepage.